Have you ever woken up one morning and noticed tiny red spots appearing all over your body? Spots that itch like crazy, that spread across your arms, your face, and even inside your mouth. It feels uncomfortable, scary, and sometimes even painful. That's not just an ordinary rash. That's chickenpox, also known as varicella, a viral infection so common that most people experience it at least once in their lifetime. And once you do, you never forget it. Today we'll uncover the truth about chickenpox, what causes it, how it spreads, what it does to your body, how to manage it safely, and how nature can help you recover faster. This isn't just a sickness. It's a story that affects millions of people every year around the world. What is chickenpox? Chickenpox, or varicella, is a highly contagious viral disease caused by the varicella zoster virus, VZV, the same virus that can cause shingles later in life. It's characterized by an itchy rash with small fluid-filled blisters. Although most cases are mild, especially in children, chickenpox can sometimes lead to serious complications, particularly in adults, pregnant women, and those with weakened immune systems. The term chickenpox might sound strange, but it doesn't actually have anything to do with chickens. Some historians believe it got its name because the blisters resemble chickpeas. Others say it came from an Old English word meaning to itch. And that's exactly what happens. Intense itching that makes it almost impossible not to scratch. The infection begins silently, days before symptoms even appear. Once the virus enters the body, usually through tiny droplets from an infected person's sneeze or cough, it starts to multiply inside. The immune system doesn't notice it right away. For 10 to 21 days, the virus hides, replicates, and spreads through the bloodstream until the body can no longer ignore it. That's when the fever starts, and the rash begins to show. How chickenpox spreads? Chickenpox spreads incredibly fast. In fact, it's one of the most contagious viral infections known to humans. It spreads through airborne droplets when an infected person coughs, sneezes, or even talks. It can also spread through direct contact with the fluid from the blisters of an infected person. If you've never had chickenpox or haven't been vaccinated, being in the same room with someone infected is often enough to catch the virus. Imagine a classroom, an office, or a small home. One person comes in carrying the virus, not knowing they're contagious yet. Within a few days, almost everyone who isn't immune could become infected. That's how easily it travels. People with chickenpox are contagious 1 to 2 days before the rash appears, and they remain contagious until every blister has crusted over. That's why isolation is so important. It helps stop the virus from jumping from one person to another, especially in crowded places like schools or workplaces. Common early symptoms include fever, headache, fatigue or weakness, loss of appetite, body aches, sore throat. Then within 24 to 48 hours, the rash begins. The rash typically starts on the chest, back or face, before spreading to almost every part of the body, including inside the mouth, on the scalp, and even on the eyelids. The spots evolve in 3 distinct stages. 1. Red bumps that look like insect bites. 2. Fluid-filled blisters that are extremely itchy. 3. Scabs, as the blisters dry out and heal. New spots continue to appear for 5 to 7 days, while older ones start to scab and fade. The hardest part of the illness is usually the itching. Scratching might feel relieving for a moment, but it can lead to scars and even secondary skin infections caused by bacteria. In most people, chickenpox heals naturally in 1 to 2 weeks. However, in severe cases, especially in adults or those with weak immune systems, it can lead to complications such as pneumonia, brain inflammation, encephalitis, or skin infections. What happens inside your body? When the varicella zoster virus enters your body, your immune system starts to fight back. White blood cells detect the viral invaders and trigger inflammation. That's what causes fever, fatigue, and body pain. The virus doesn't stay in one place. It travels along the bloodstream and enters skin cells, causing them to burst and form blisters. But here's something fascinating. Even after you recover, the virus doesn't actually leave your body. It goes into hiding, resting quietly inside your nerve cells, often for decades. Years later, the same virus can reactivate, causing a painful condition known as shingles or herpes zoster. That's why adults who've had chickenpox as children sometimes experience shingles later in life. The good news is, after a chickenpox infection, your body develops lifelong immunity. Your immune system remembers the virus and can quickly defend you if you're ever exposed again. Home remedies and natural support. Modern medicine provides effective treatments for chickenpox, but natural remedies can greatly help ease discomfort, soothe the skin, and support healing. Here are some natural remedies known to bring relief and promote faster recovery. 1. Oatmeal bath. Oatmeal has soothing and anti-inflammatory properties. Grind plain oatmeal into fine powder, mix it into warm water, and soak for 15 to 20 minutes. It helps reduce itching and irritation. 3. Neem leaves. Neem, or Indian lilac, is known for its powerful antiviral and antibacterial properties. Boil neem leaves in water, let it cool, and use the water for bathing or gently wiping the skin. 3. Baking soda solution. Mix 1 teaspoon of baking soda in a glass of water, soak a soft cloth, and gently dab it onto itchy areas. This helps calm irritation and prevent further inflammation. 4. Honey. Pure honey has natural antibacterial and healing properties. Applying a thin layer on the blisters can prevent infection and speed up the healing process. 5. Coconut water and moringa. Drinking fresh coconut water helps hydrate and flush out toxins, while moringa leaves strengthen the immune system. Together, they help the body recover naturally. Important reminder: never apply any remedy directly to open wounds or broken blisters. Keep the skin clean and dry at all times. These remedies don't cure chickenpox, but greatly help relieve symptoms and prevent secondary infections. Medical treatment. For most children, chickenpox heals without any major medical treatment in about 1 to 2 weeks. But for high-risk individuals, such as adults, pregnant women, or people with weak immune systems, antiviral medications may be prescribed by doctors. The most common antiviral used is acyclovir, which can shorten the illness and reduce the severity of symptoms when taken early. Doctors usually recommend rest and hydration to help the body recover. Fever reducers like paracetamol. Avoid aspirin as it can cause Reye's syndrome. Calamine lotion or antihistamines for itch relief. Loose cotton clothing to minimize irritation. And remember, never pop or scratch blisters. Doing so increases the risk of infection and scarring. Prevention. The power of vaccine. The most effective way to prevent chickenpox is through vaccination. The Varicella vaccine is usually given in 2 doses, one at 12 to 15 months of age and another between 4 to 6 years old. For older children and adults who've never had chickenpox, the vaccine can still provide strong protection and prevent serious infection. Even for those who had chickenpox before, vaccines can help reduce the risk of developing shingles later in life. Simple hygiene practices also help a lot. Avoid close contact with infected individuals. Wash hands regularly. Disinfect commonly touched surfaces and items like doorknobs, phones, and toys. Vaccination not only protects individuals, but also prevents community outbreaks, protecting infants, elderly people, and those with weak immune systems. When to see a doctor? Most people recover at home, but sometimes medical attention is necessary. You should see a doctor immediately if any of the following occur. Fever lasts longer than 4 days or goes above 39°, 102°. Blisters become swollen, red, or filled with pus. The patient has trouble breathing, chest pain, or confusion. The patient is pregnant or immunocompromised. In rare cases, chickenpox can lead to pneumonia, brain inflammation, encephalitis, or skin infections. Early medical intervention can prevent complications and save lives. Emotional side and family support. Beyond the physical discomfort, chickenpox can also take an emotional toll. especially on children who might feel embarrassed or anxious about their appearance. During recovery, family support plays a major role. For adults, self-care and rest are equally important. Chickenpox may seem like a simple childhood illness, but it teaches us powerful lessons about health, prevention and compassion. It reminds us that even small actions, washing hands, getting vaccinated, supporting one another, can prevent the spread of diseases. So the next time you hear about someone with chickenpox, don't panic, understand. Parents can comfort children, provide soothing baths, keep them occupied with gentle activities, and remind them that the scars will fade over time. Allowing the body and mind to rest helps speed up recovery and prevents complications. Healing is not just physical, it's also emotional. Kindness, patience, and care go a long way in the healing journey. Conclusion. From the first red spot to the final scab, your body fights, learns, and heals. If you found this video helpful, don't forget to like, share, and subscribe for more educational health content. Nature has always been our greatest healer, and once healed, it carries a memory, immunity that lasts a lifetime. This has been Pure Remedy, your trusted source of natural health and wellness information. Take care of your body, protect your health, and remember, because with the right care, rest, and knowledge, recovery is always possible.